To go over docucare, and we're going to create a patient chart. Students will generate a patient chart on each other, and so that's they can do a GI or integumentary, or they can do neuromuscular. So first, when you get into docucare, sorry, you move to 380. The course is already there, and you say preview as a student, because this is basically a student activity. So they will add a new patient. So when they add a new patient, um, here they will say something like, let's say GI assessment. At what time did your clinical start? And you can just say this is the time. That's fine. How long has the patient been in the hospital? I'll probably put 2 hours, 0 days. And the age will be whatever the student's age. And let's say it's young adult between 20 to 39 years old. And the gender, let's say it's a female student. Treat as a maternity patient, say no. And you can select ethnicity here. And if somebody don't want to select it, then you can put other. If you put other, you will write here as what specifically other is. So here I'm going to just put Asian. The category is non-Hispanic, Hispanic, or Latino. Ethnicity here, I will just put, you can still put Asian here. And put a height, you can put in, let's say, if somebody is 5 feet, then 5 feet, it'll be 60 inches. And say weight is in pound, and you say 112 pound. And say marital status, you say married. Religion, you can put as a Christian. You can select, denomination. You can put a Baptist. Advanced directives, you say full code. Isolation precaution, you say standard precaution. Primary admitting diagnosis, you can do a search here. Let's do a search. Let's do indigestion. So let's see dyspepsia, if they will have anything. Okay, so see what they have come up with. Okay, this one does not like, okay, does not really like it. Let's select something with gastritis. Let's see. Okay, so this one, let's just put gastritis here. And I believe here, if you want to just say, and let's do abdominal pain. Let's see, abdominal discomfort. Abdominal. Let's do a search. Let's see. Crohn's disease. Okay, so let's just um, say save here. So we put a gastritis. The gastritis, the one first I choose, it has been selected. And then they do the assessment. So you want them to do abdominal assessment. You want them to do GI assessment. So when they go to GI assessment, they will say abdomen, four quadrant, soft, flat, non-distended, no tender, and that's it. So GI symptom, you can put nauseated, um, if they have some other symptom, you can say abdominal pain. And is bowel sound present at the four quadrant. If you say, or you can say they are hyperactive. And the diet tolerance, you can say inadequate because of nausea. And here is the stool. So they do assessment. This is stool, soft, little bit of mucus, small amount, and loose. Color is, let's say, yellow greenish color. Last bowel movement was yesterday. Okay. So anytime you do this, it's a save. You need to do a save. Okay, here, documented, you need to say time is required here, and then you put 1900. And then you say save. Then you want to do a GU. You want to rule out if there is a urinary tract infection. So you put, no dysuria, no frequency, urgency, urination. The urine color is a yellow and it's a clear and a void without difficulty. There's no catheter. If you did a genitalia exam, then you need to put it there. If you have anything specifically you want to document, you can put it right there. Again, you can save it. You can put this one as 1900 again. I usually want the student to at least do some neurological orientation, person, time, place, situation, so that oriented times of 4. You see them move well with all 4 extremities, no focal weakness on one side or the other. They have not yet done pupils, so I'm going to leave it right here. So this is a pain scale because the patient also have pain. So you want to record a new pain assessment. You can say documented at 2 on second. You say it's 1900, and the pain location is upper. Let's say epigastric. And onset say was yesterday, last night around 2000. Pain duration is about let's say 3 hours. Let's put a minutes here. 180 minutes. Pain frequency, you can say it's intermittent type of pain. You say it's new to patient, so it's acute to patient. And he described it's just aching a little bit. So if you want to, you can say pain is tolerable to patient. She is anxious and worries about the cause of the pain. You can put it as new onset, so because it's new, right? And here is aggravating factor. It said it's basically eating, so you can say had a heavy dinner last night at a Thai restaurant. Something like that. Alleviating fact is you can say was no, you can say something like immobility, because let's say they have not yet tried anything, and compression. Okay, so you can put a comment here, the pain rating here, you can say 3, and the characteristic, you can say this is really just aching, it's there. Okay, sorry about that. Then you say safe. So this is it. This is what you expect your student to do with the GI, GU, and the neuro. You want them to do some, and if you want them to do integumentary, you let them do that. And if you want them, of course, they should document a new set of vital signs, because that's what we require them to do. So you can put it here as 1900. And you can put blood pressure as 110/60, and the location, let's say right up arm, and in sitting position, heart rate is 75, respiration is 16, SpO2 is 98. Oxygen delivery method is room air. Temperature is 98. Root here you can say is axillary. And if you have any comments on any of the vital signs, okay, then you say safe. So they basically just create the patient, and they're going to turn it in. So you say the student will say submit, and once they submit, they can put whatever the comments they want to say. Say, please let me know if I did these right, and then submit for instructor to review. So that's one of the assignment. They can do it very simple, easy. Hope this is helpful. Just let me know if you have any